Well, welcome everybody to today's webinar. It is What is Occupational Therapy and What Can It Do for Me? Today we're having Jenny, sorry Jenny if I say this wrong, Junker, and Kristen Hapke speaking, and I'll go ahead and let them introduce themselves, and just to let you all know that we are recording this for our YouTube channel.
Thank you, Melissa, and thank you to the Parkinson's Association of the Rockies for having us. I'm very excited to present this as part of my doctorate capstone project in occupational therapy. And when I was going through all of the PAR's resources, I realized that you guys had not had an occupational therapist. And so I thought this is such a valuable information to give to people with Parkinson's. And I'm very grateful for Jenny Yonker for joining us today. And if you will give just a little bit more information about yourself, Jenny, that would be great for Dr. Yonker.
Sure. So I'm Jenny. I'm an occupational therapist. I've been in OT for about 12 years now, and always worked with older adults. And then probably 5 years into my career, so I focused a little bit more on Parkinson's specifically and became a team lead for Parkinson's. And I became LSVT big. Okay, can you hear me?
Yes.
Is that better? Okay, I'll take them out. I thought it would be better, but I don't know if everybody got that. But basically, I've been in OT for about 12 years, and I currently am the co-owner of Thrive Therapy, which is a mobile outpatient therapy provider. So we see people in their homes or in the community. We bill Medicare Part B, so it's different from home health. You don't have to be considered homebound. And I've always kind of taken a passion for working with people with Parkinson's and have done LSVT big training along with Parkinson's Wellness Recovery, or Power Up.
Great, thank you. Like I said, this is part of my doctorate capstone project. I am very much interested in working with people with Parkinson's and do have my LSVT big training. Part of this capstone experience, I have been able to work in the community and through assisting and teaching classes, exercise-based classes, both dance and punch boxing. My background is in movement and dance. I've been a Pilates instructor for over 20 years, helping people with their balance and their strength, as well as being a movement analyst. So I'm a big believer in movement as therapy. Let's go ahead and get started. So this is our outline that we have for today. And just to point out that I hope my objective and my mission for you is to give you some tips to help you throughout your day with Parkinson's, as well as to teach you more about what occupational therapy can do and possibly be part of your care team. This month is Parkinson's Awareness, as well as Occupational Therapy Month, so advancing the health, well-being, and quality of life. Just a little side note, if you have questions as this goes along, feel free to put your questions in the chat box, but at the end we'll be taking questions. And then I just have a brief little survey, about 4 questions at the end in terms of part of my capstone project. All right, so what is occupational therapy? A lot of people don't quite understand the scope of our practice or what it really can do. And so it's an holistic client-centered therapy to help you engage in activities that are important to you. It is very individualized for your own needs and goals. We know that people experience Parkinson's in many different ways, and we use a strength-based approach in this therapy. And many of the clinicians are specifically trained with neurological progressive diseases. Jenny, would you like to speak anything else about how in your practice is client-centered and holistic?
I think something that gets mistaken often is you might have had occupational therapy in the past, and maybe it's been in a hospital or a rehab center. And I think a lot of people just think that occupational therapy is working on self-care or we would call like activities of daily living, which Kristen's going to talk about here in a little bit, which is a focus of occupational therapy. So some people might say, well, I can get dressed, I can take a shower, you know, I don't really need that. But I think it's important to recognize that we do a lot of other things besides that, and we really look at you holistically, like Kristen mentioned. So maybe, you know, you're having some trouble with your memory. Maybe it's not necessarily, you know, getting yourself up and dressed, but maybe you want to participate in some community activities and you're not able to. Maybe it's trying to figure out if you want to return to driving, or you need to figure out some transportation options. There's all sorts of things we can work on with you. And one of the things we really try to do the first time we see you during the evaluation is figure out what are your goals and how can we collaborate to work together to reach those goals. So, I mean, we always give our 2 cents, of course, you know, the things we know and tips and tricks, but if you're not wanting to work on showering, then that's not something we necessarily need to address. So I think just knowing that really we want to work on what you want to be able to do as well.
Great, thank you. Yes, oftentimes people think, oh, I don't need occupational therapy. I'm not working right now, I'm retired. And so if we think about perhaps occupations in terms of activities that we want to be able to do, as well as throughout the stage and the progression of Parkinson's, and I'll talk more about that. We'll talk more about that, about when occupational therapy can come into your life. So research has shown that a multidisciplinary team for Parkinson's is the best. This is just a few of medical professionals that can be on your team. Of course, a movement disorder specialist or a psychologist, a nutritionist are some other important things. And occupational therapy is a very creative medical profession within a variety of settings and population that Jenny spoke about. But I have here just the scope of practice. So predominantly activities of daily living. We want you to be as independent as possible and continue the things that you love to do. We look at your home environment, especially Thrive Therapy. We look at your mental health, connecting you into social environments and community settings, or continuing to have you invested in those. Gross and fine motor skills, especially fine motor skills, are in our scope of practice that we specialize in. Enhancing your cognition. Many people get a specialization in vision. So if you're having any issues with low vision or vision issues, it's something that we can address. Ergonomics, both in your workspace if you are still working, as well as just in your home environment to make things more efficient for you. There are pelvic health specialists, OTs, as well as driving specialists. I'm going to move on then. So just an overview, we support you in independence and safety. The idea that we want to actively keep you involved in your life, and that we create and promote wellness programs or exercise-based programs as well. And that we help provide memory and cognitive strategies. If you're challenges that are coming up for you, we can provide lots of strategies to help you do that. So together that we are setting realistic goals, identifying challenges, and strategizing solutions to improve your quality of life. Jenny, is there anything else that you'd like to add?
Oh, sorry. I think that's pretty good. I think, yeah, just knowing that, well, Kristen will probably mention this soon too, but I don't know that there's ever like a wrong time for an occupational therapy evaluation. Even if it's just like a one-time evaluation, it's good to kind of get a baseline, even if you're newly diagnosed, like let's see how you're doing right now. And maybe you're not having trouble and that's okay, but we could give you some tips and things that you could still continue to do, or maybe add to your current routine. And then as it progresses, you know, it's kind of one of those things where like you kind of every now and then it's kind of like a little tune-up, we say, like you got to check in, you know, kind of like you do with your doctor, maybe every 3 months, every 6 months. Maybe you just need a little tune-up for a few weeks and then you're good. So just keeping that in mind.
Great, thank you. Yes, and having this team approach, people in the team can correspond with each other and stay up to date, or they do stay up to date with the most evidence-based practice. So it is nice to have a team that you can then check back in. So many of you probably know this about Parkinson's, but I just want to give a little bit of an overview and talk a little bit about symptoms and what we can help you with. So Parkinson's disease statistically affects 1 million people in the United States, and that's supposed to rise to 1.2 million in 2030. Parkinson's is the second most common neurodegenerative disease after Alzheimer's, and it is a central nervous system movement disorder. And this is due to a decrease of the neurotransmitter dopamine and dopamine pathways and receptors. So predominantly, dopamine is produced in a part of your midbrain in the basal ganglia, particularly in the subsida nigra. And this area of the brain helps control movements. And so many of the motor symptoms are commonly known, but I just want to point out a lot of the non-motor systems also can greatly affect your daily life. And so we have a lot of strategies and things to help with that as well. So speaking of the motor systems, so bradykinesia is probably the most defining symptom of Parkinson's, and it's basically the slowing down of movement. The face might change a little bit. There might not be as much expression in your face, fine motor skills, and in general, it just takes a little longer to do things, longer to eat, longer to get dressed. The other side of bradykinesia is dyskinesia, which is these involuntary movements. And again, it might be a limb, or it might be your face or a neck. And sometimes this can be just a respondent of the Parkinson's drugs. But that's just something to kind of to note about, and looking at the idea of tremors. Oftentimes we think that that is the main defining symptom. But the tremors can come and go, and actually a lot of research has shown that when you're engaged in an activity that you really enjoy, such as maybe like painting or coloring or something like that, that the tremors can go away. So, momentarily, so that we really advocate for being engaged in activities that you enjoy for your body. The postural and rigidity, the instability of our posture can lead to balance issues, and I'll talk more about that. I just wanted to point that out about walking and gait, sort of the thing that we often think about in later stages in Parkinson's is this kind of rounded forward shoulders, head forward, and sort of that shuffling gait. So definitely occupational therapists and physical therapists work on building up strength as well as increasing the bigger steps of your gait and posture. In terms of the non-motor symptoms, some of these will be experienced actually before people even notice that they have Parkinson's. I think 50%, something like 50% of patients noted pain, but didn't realize that that was a part of Parkinson's. And so these can be anything between mental or behavioral changes, mental fatigue, cognitive changes, perhaps difficulty with planning or memory, mood aspects. We know anxiety and depression are a big part, as well as apathy. So the idea of lack of interest and enthusiasm or motivation. And this can be sort of a vicious cycle, since if you feel sort of not motivated to exercise or perhaps follow along with your medication, this, like I said, can be a cycle. And so we just help encourage you to get more actively involved, and therefore being engaged in activities and exercises helps your mood. And there's a lot of other issues in terms of gastrointestinal issues, speech and swallowing problems, LSVT. Loud is a good thing for speech, and having a speech therapist on your team is a good thing. But could also be like bladder and bowel changes, constipation, issues with sleeping in terms of REM and restless leg syndrome. So I just wanted to kind of point out a few of those. I know that some people in my classes that I have been working with have talked a little bit about dizziness and changes in blood pressure and orthostatic. So something just to kind of note, especially perhaps getting out of a shower, those kind of things. So these symptoms vary in both intensity and how long they progress from person to person. So early symptoms are usually pretty mild and can last for a long time. And in terms of the stages of Parkinson's, there are 5 stages of Parkinson's. Unfortunately, that scale is based only on motor symptoms. But when you get to about stage 3, that's when you perhaps have some issues with your balance. And stage 4 is where they recommend not living alone. And then in terms of medications, the timing of when you take medications is extremely important. And we try to have you maximize your greatest energy, after you take medication and be able to do things that you want to be able to do in your life. Jenny, would you like to add anything about what you see as some common symptoms?
I think it's great to point out all of these, but also keep in mind, like Kristen mentioned, you may not necessarily have all of these symptoms. And I feel like it sounds like a lot. Like if this were me, I'd be like, oh my gosh, this sounds terrible, right? But just know that, like she said, they vary in severity, and maybe you don't have tremors. I've seen some people that don't really have tremors. And okay, that's just really interesting because, like she said, a lot of people just associate tremors with Parkinson's. But I think it's important to keep in mind there's other things that could be going on, but it could also be from, other conditions you maybe have or medications you're taking. But sleep is a huge one that I see a lot of people struggle with, bowel and bladder issues as it progresses. And then I would say cognition is probably a big one also. And going along with that, kind of that flat affect. So really not having a lot of expression when you're talking, not a lot of like intonation or changing the tone of your voice. Those are probably the main kind of non-motor symptoms, I would say. And then motor is probably the common ones, the bradykinesia, the rigidity. So a lot of times you might notice you don't swing your arms, or maybe your therapist or someone will point that out. Difficulty with arm swing and just turning, especially at the trunk of your body. It kind of just stays, you kind of just stay in one straight line almost. And then I just think with the gait, you might start to shuffle, you might have trouble over threshold, some people will freeze, some of those kinds of symptoms are pretty common, but there's some tips and tricks too that therapists and your team can help you with. So don't be discouraged, and just know it depends on what symptoms you might have, but these are great to know.
Yes, thank you. I appreciate that. And each person will have different goals based on their symptoms and their progression. So whether you're living with Parkinson's for 1 month or 20 years, like we both have been saying, that whatever your goal is will match your personal strengths with those activities that you want to be able to do. So one big thing is that we support independence, especially with activities of daily living. And I have a few of them here, as well as instrumental activities of daily living. So this could be managing your medication, driving, taking care of pets, laundry, cleaning, shopping, finances. So we are there for you for these as well. And the next couple of slides, I have a couple tips, and feel free to add in, Jenny, as well. So in terms of dressing tips, so managing clothing sometimes or making changes can help reduce your frustration. So taking time to get dressed, and again, avoiding hurrying, which would lead to more stress and can make your symptoms worse. So we recommend sitting down when getting dressed, and perhaps doing a few stretches, especially if you have maybe a stiff limb. You want to put the stiff limb in your pants first, or in a sleeve first. You could also use a footstool, and then consider some assistive devices as well to help put on shoes or socks or those kind of things. So I have a couple of our adaptive equipment here. In general, gather all of your items that you're going to use to dress first, and that will just help reduce and conserve your energy. Easy removal clothing. Sometimes if you have a bladder urgency, if you're having some issues unbuttoning or zipping pants, just having Velcro or having being able to take off the pants quickly, especially at night or something. So we do recommend those. We do recommend wearing non-skid socks instead of bathroom slippers, just in terms of being able to walk easier. And wearing supportive shoes with either a Velcro closure could be easier for somebody than rather than having to tie shoelaces. And like I said, here are some adaptive equipment, a button hook if being able to button for their fine motor skills is difficult, zipper pulls, a sock aid, dressing stick. And again, these might come much later.
Can I add something real quick?
Yes, yes, of course, sorry.
No, that's okay. There's also nowadays a lot of great adaptive clothing. So you can even search on like Amazon, and they make like button-up looking dress shirts that have magnets, which I've had people say mixed things about. Like it's great, easy to get on, but I've heard they can come apart a little bit easy. But they make also some that have Velcro that, again, it just looks like a button-up shirt, but it's Velcro in between the fabric instead of the buttons. So it's like pre-buttoned, if that makes sense. But if you just Google or go on Amazon, there's all sorts of things you can find. And then I was also going to mention with the footwear, there's great slip-on shoe options now. Kizix is a great brand. I've had a couple people with Parkinson's love because the heel of it just helps you like slide your foot in, and then you just kind of step on the heel of the shoe and it kind of slips your foot in. So again, it's something that you can put on easily sitting down. You don't have to bend over and have to try to manage the sock and the tying and all of that. So just know there are some great options, and then OT would really come in handy if you were struggling, even just for some tips about that or things that might be individual to you.
Great. Yes, there's so much that you can find on Amazon, and thank you. A lot of that was in my notes, so I appreciate you saying, adding on to those. I'm going to move on to bathing, grooming, and hygiene tips. So we definitely recommend sitting and using a handheld shower head for multiple reasons, but when the bath is or the shower is pretty warm, again, blood pressure may change, and so it's just a little bit safer to be sitting rather than having to get up all the time to adjust the temperature and that kind of thing. Also, bath mats are really crucial so that there's no slippery surfaces. And grab bars. Grab bars are essential to have in the right placement. I know that that is an important factor as well. So you want to have the grab bars if you were to reach and extend out from you from about your elbow and arm reach there. And it's good to have one going into the shower area as well as in the shower area, just to be more independent. We also recommend using a pump soap, so you could use that just a little easier than having to open bottles and that kind of stuff. In terms of grooming and hygiene, electric toothbrushes and razor can just conserve energy and be helpful. And then in terms of bathroom, having an elevated toilet, because oftentimes toilets are very low, and so to be able to get off from. And so just an easy overlay can help give support on the sides there. And then I am a big believer in bidet. There's a Tushy company is a great company that you can just get a little bidet attachment. I think I should get a refund for all the times that I promote the Tushy company. That is also just a nice way to be independent and clean. Would you like to add anything, Jenny, to that?
I don't think so. There is, as far as bath mats go, the one thing I usually recommend are these like strips that are like $10 on Amazon, and it's like really, they're stickers almost, but they're really sticky. So you can kind of decide where you're putting them in the tub. So maybe you only want them on half, or you can kind of decide how you want to lay them out and stuff. I think those, they look nice, they're easy to clean, they don't get like the yucky mold stuff that a bath mat gets, so that's a great option. But everything else you mentioned, yeah, I agree.
Great. All right, moving on to meal prep and eating tips. So one major thing for energy conservation is basically to reorganize your kitchen so that you're able to be accessible to the things that you use often. And then if you're going to do meal prepping, gather all your supplies and sit at a chair or a table. It just helps to be able to have enough energy then for later on in your day when you want to be able to do things that you really enjoy, or maybe you love cooking, maybe that's what you enjoy. Here again are some built-up utensils. Sometimes, like Jenny had mentioned, in terms of other symptoms can be exacerbated, like CMC arthritis or arthritis in the hands. So actually these built-up utensils help that you don't have to squeeze such a tight grip, just give a little bit of support. Weighted cuffs can help if you are experiencing a lot of tremors, or this idea of slipping the hand through if you're having some rigidity and tightness in your forearm, and rotating your wrist and hand is difficult. That way you can really keep food on the rotating your food, spoon or fork. In terms of cutting boards and keeping things stable to be able to cut with, there are cutting boards that you can place the vegetable right in those thongs there to be able to stabilize it, or dice them, which is just a piece of blue sticky, like a help with the surface, or on top to open jars. There's a rocker knife, because some people might not have sensation, or they might feel one hand is more affected, might lose some sensation. Sometimes having a rocker knife to be able to cut just helps aid to your safety. And then of course using electric tools. So basically just making some small modifications in your home can really make a big difference. And planning is really the key to success in cooking, basically to save energy and just to help have the experience be better for you. All right, I'm going to move on if that's okay. So a couple key things here, because we talked about as a central nervous system, having some stress management in your daily life. So this could just be taking some time to just have practice your breathing, enjoying nature, listening to music, things that can just sort of calm your nervous system a little bit. And research has found that being in routines can kind of help your brain as well navigate your daily life. As occupational therapists and physical therapists, we would strongly encourage you to have exercise in that routine as well as reaching out and seeing friends and other people who may be experiencing Parkinson's as well can really help you. I spoke about energy conservation. Work simplification is just the idea to work easier, not harder. Adaptive equipment we've been talking about, home environment, and we'll continue talking about, and just the idea of having schedules, sometimes even scheduling a little short break, which is what I have for you now. So go ahead, if you're sitting in your chair, just go ahead and reach the arms out, take a big stretch here, opening and lifting your chest up. Perhaps you could even stretch your neck a little bit, whatever feels good in your body. And then I just want to encourage you to take some deep breaths in through the nose and a long, smooth exhaling out. Especially if you're experiencing any pain in the body, taking some deep breaths can really help calm our nervous system and tap more into our parasympathetic nervous system versus our sympathetic nervous system. Great. All right, I'm going to move on after your deep breathing here. Great. So continuing with supports to help navigate your daily life. Home safety is in our domain, fall prevention, exercises, as well as community engagement. All right, so fall prevention. Does anyone know how many people, people with people with Parkinson's fall each year? And my animation I don't think is working here, but it's about 60% of people with Parkinson's fall each year. And unfortunately, 2/3 of those people will have a repeated fall. So fall prevention is very important to us as occupational therapists. We want you to stay out of the hospital. And so we've talked about a few tips in terms of your gait and posture. Some other strategies include like visual spatial strategies. I think Jenny spoke about this in terms of having even just markers or delineation between surfaces. Sometimes if you're walking up a stairwell, being able to go completely to the very top so that there's no falls backwards. Being able to see the distinction of steps. So sometimes just having a yellow color piece of tape can help with that. And again, just keep working on that strengthening of your upper body in terms of posture, as well as your lower body in terms of really getting your feet to move in a wide base of support. And exercise definitely helps prevent falls. Jenny, would you like to add anything else?
The only thing that comes to mind is I'm not sure if anybody has heard of or seen the U-step walker. I think the Parkinson's Association actually has some perhaps that maybe you can trial. I don't know that for sure. But it's a walker that instead of typically you would see the walkers like the four-wheeled walkers that you would squeeze to brake or push down and then the brakes are locked. It's actually the opposite. So you have to squeeze in order for it to go. So if you let go, it brakes. The idea is to be a little more intentional in your walking. So the walker is not going to get away from you like it would if you were maybe using a traditional four-wheeled walker. And then some of them also have the feature of a laser pointer. So it just has a red line that goes kind of right, I guess, in front of your feet a little bit. And the idea is to step over the line, sort of that visual spatial, making sure you're taking larger steps, because shuffling really can cause you to get your feet underneath you and fall. So trying to just be more aware and in tune of those large exaggerated steps. Very similar to what LSVT big kind of preaches, and kind of making your large steps your new normal or your typical movement. Same kind of idea, but it just gives you sort of a visual. So just know that's out there. And again, that's more kind of as you would progress in your disease. And it's not always appropriate for everyone, but it can be a really great option.
Great, thank you. I actually had forgotten about that, so thank you. Oh, there is my 60%. All right, so some of these basic home modifications just to help preserve function and have you live at home longer. So oftentimes just a few changes can make a big difference, like I had said. And we recommend very just affordable equipment, usually not big renovations or anything that needs to happen, especially even later down in your progression. But looking at some things that might be tripping hazards. So eliminate throw rugs, of course, any slippery surfaces, rearrange environments you can get around things a little bit easier, especially if perhaps you're using a walker or cane. We do recommend not carrying things in two hands if you need to. That way you just have more access if you need to, if you feel like you're going to fall. And let's see, lighting is super important as well. If you're getting up several times at night, you want to make sure that your access to the bathroom is very clear and easy to see. So I highly suggest motion lights as well as touch lights, just things that are easy for you to be able to get to and be able to use. Talked a little bit about already the idea of targets. Railings are really helpful if you have steps. Definitely get railings. Excuse me. We already talked a little bit about raised toilets and the tub bench, and basically just to reduce clutter. So thinking about just making it easy to get to things and navigating around. And in general, it's better to have steps like in your garage going into your house, especially in Colorado, than outside where the steps can get really icy, especially black ice, or it might be hard to see. So those are just some things in terms of the home. Feel free to add if you'd like to, Jenny, anything else?
I think that covers it. I think just making sure really that you have clear pathways. If you were to, let's say, drop something, trying to kind of think ahead, what would I do? Because I've had people that, try to go reach for it and then that's when they're falling. So maybe it's keeping a reacher close by or just waiting until somebody gets home, depending what it is, of course. Or just trying to make sure that your home is set up well. We don't really like rugs, ideally. Try to tape them down or get rid of them. Or if they have the rubber back, they can be okay. But again, it's just a big tripping hazard. You could get your toe caught and then you're going down. So just kind of thinking about, even ahead of time, is this a good setup for me? Do I have a bunch of stairs I need to do? If so, can I manage them? Do I need a railing? Maybe I need 2 railings, even like stairs into and out of the house into the garage. Usually there's no railings on those. So I've had some people, maybe put in like a vertical grab bar kind of to the side that can help, or maybe you want to add a railing, just things that you can think about. I think just to, again, we'd rather that you be safe, even if you're not using them, than to have a fall or something happen.
Definitely. I think about the times that I've had falls, and it's usually that I'm not paying enough attention, trying to multitask, rush. So even those kind of things of slowing down a little bit, really navigating where you are, really seeing around you.
Oh, and if you have a walker, use your walker. Sounds easy, but I feel like a lot of people just kind of are like, oh, I'm going to park it across the room out of the way, or I don't really need it inside my house. But really, if you should be using one, if your doctor or your therapist or someone has said, I think it's a good idea, really do try to use it. Yes, you can furniture walk, but that's not the safest option. And really just even for carrying things around, like Kristen said, especially the 4-wheeled walkers, you can put stuff on there and take it into the kitchen, out of the kitchen, into the bedroom. It's great just for moving things also. Your laundry basket even.
Yeah, definitely great. Okay, getting more into the occupational therapy rehabilitation for Parkinson's. So as Jenny mentioned, that it's never too early to get an occupational therapist on your team, and just there in case you need to check in every once in a while. In the beginning stages, even before you're having any symptoms, it can really help you, just educate you about the diagnosis, and it can help just set up those good routines for yourself. We've talked about strategies to manage symptoms, and of course, an OT can give you more of those. If you are working, we can, of course, help you with work-related activities and adaptive equipment. And we are masters of helping and strengthening the upper body and hand coordination. So I'll talk about that coming up. But exercise is the key, and exercise is medicine. In fact, exercise as medicine has less side effects than sometimes some of the other medication does. There are so many benefits of exercise. So it increases natural dopamine and helps to build new neuronal pathways in your brain and new connections. The idea of neuroplasticity, basically that you're rewiring synaptic connections, and you're increasing blood flow, nerve growth factors. It improves your walking, balance, flexibility, and didn't mean to write that, better posture. So we talked about that in terms of helping pain and just become more efficiency in movement. Improves endurance, and it puts you in a better mood for sure. So it can help with anxiety and depression, and you're oftentimes in class with others. There are so many classes, especially I put in a little link here to Parkinson's Association exercise schedule. There are so many classes that are designed for people with Parkinson's, and you get to be in a community with them. Just speaking from the last 14 weeks that I've been with, I'm going to so miss my boxing class, as well as the dance class and movement class. Just such great people. So definitely thinking about exercise. If you've not had exercise, we can help you with an exercise program, or just start to think about activities that are fun for you to do. And I'll talk a little bit more about that. So exercise definitely helps cognition and brain health. You might experience some changes in executive function and being able to complete tasks, or you might notice some changes in your attention. So the idea of being able to maintain attention, or as well as having divided attention, dual tasking, being able to do two things at once might become challenging. And with the bradykinesia, this idea of delayed processing, and you might have challenges with recall. So we can just give you some tips and tricks to be able to help you with those aspects. So we really work with you as well as with your care partner to be able to figure out strategies to make yourself the best. And so looking at like what would maybe, if you're having difficulties with a task, what would make this easier for you if we broke it down into repeatable aspects that you could repeat and work on? Or what is some different ways to be able to do this task now that you're experiencing these symptoms, or maybe you will be in the future? How could you do this a little differently? So all of those just sort of help that idea of slowing down the disease process and preserving what you have. Like strengths, focusing on your assets and your strengths, and making on your strengths. All right, I'm going to move on unless there's anything I'd like to add, Jenny. Do you like? Okay. So like I said, enjoying activities. This is really the large domain of occupational therapy in terms of the activities. And preferably they're movement-based, but just occupational therapy activities just to improve your quality of life. Getting outdoors really helps our mood and our brain. Gardening, playing with grandkids. There are a lot of people that also do Parkinson's ping pong, has been proven to be very successful helping people, or just throwing a ball. I was recently listening to a podcast that this woman says, I just try to throw a ball against the wall, for a few minutes every day to keep that eyeball coordination going. Biking, I know Davis Finney has quite a lot to do with biking, and biking is something that there's a large group of people with Parkinson's that do. Hiking, since we are in the beautiful Rockies here, there's a lot of amazing places to go hiking. Do recommend hiking sticks just to help both sides of the body being able to work. I use hiking sticks and love them. Golfing, yoga. Yoga has been in a lot of research help with stiffness of the body, just that idea of stretching, mindfulness, and meditation that can help. Tai Chi is a great thing for balance. And water aerobics, especially if your joints are starting to bother you, if you have arthritis and whatnot, water aerobics can help alleviate that as well. But there's a ton of them. As well as, like I said, just picking up something new as well. Research has shown that learning something new really helps build neuroplasticity in the body. And just to try something new, I never thought I would be very good at boxing, but it turns out I do love it, the non-contact boxing aspect of it. All right. So the best fitness routine is one that you will do, one that you will have fun with, as well as challenging yourself. So the idea is making it fun and in groups with other people. And the recommendation is to get some sort of a moderate to high aerobic activity, getting your heart rate up a little bit, having something that strengthens your body, increases your flexibility, as well as balance exercises. And that you're mixing skill-based, not just the physical base, but also skill-based that evokes your mental and cognition. And like I said, trying something new. And there is quite a lot of research for both yoga, boxing, dance, and Tai Chi. Ideally, research has shown that 3 times a week for 30 minutes is ideal, but you could certainly do more of that. One thing that comes up if people are feeling very fatigued, actually exercise can help boost endurance and help boost energy. So give you a little bit more energy to be able to, do the tasks that you need to be able to do. Jenny, would you like to add anything of what you notice of exercises that have been successful for people, or what do you include perhaps in some of your OT sessions?
Yeah, I actually do try to include boxing pretty frequently. I have some boxing gloves I carry around with me. I just think it's really fun and it's great for your cognition as well because you have to try to remember the sequence, or maybe we pair it with, something else, numbers or words or whatever. So I think it's just a great challenge overall. And you can, as a therapist or, even as a patient in your session, we can modify it. So it's not like you have to be standing really doing the boxing. Maybe we do it sitting. Maybe we do, a short little sequence a few times, take a break. So it's not like, I think some people get a little intimidated, kind of like you said, Kristen, because it's not very common. Like it's not like most of us have probably done boxing before. And we think of like being in a ring and doing all these boxing moves, and it really can be what you want it or need it to be. So I really do like boxing. I also think yoga is great. I don't use it probably as frequently as I should. I try to use things that people enjoy doing. So maybe it's walking into the mailbox to get the mail. Well, then that's what we're going to do, or that's what our goal is going to be, and we're going to work towards that goal. It can be anything, kind of like she was saying, all sorts of activities, and especially learning something new. So maybe you've never done boxing. I think it's great to give it a try. And one thing she didn't mention that we talked about previously is a lot of the classes on through the Parkinson's Association are also virtual. So while it is great to be in a community and be social with other people, you can also do it just like this. So you just log in and you follow along. I mean, I think it's it would be best if you could be in person, but I know with scheduling and maybe transportation and things, it's not always possible. So it's a great option also to just do it through the computer.
Definitely. I know the Moving Through Parkinson's with Lisa Morgan up in Fort Collins, she has a lot of people Zoom as well. So thank you for adding that. And that's a great segue. I'm going to talk about hand strength, and I do have some videos here as well. We might not have time to do them, but at least be able to show that on YouTube there are so many videos as well as Zoom classes. So increasing hand coordination and strength. We talked a little bit about already these handles, build up handles, and the idea of scheduling tasks that require hand control at times when you're well rested and medications are working well. And I'm just going to flip through. Here we are with some videos that are specifically designed to help people with hands strengthening and coordination. The first video, we won't have time to show these. First video looked at mudras and being able to have this mindfulness when doing hand motions. And the second one is looking more about the actual exercises. So just opening and closing your hand, flicking, coordination, trying to go fast between the pads of your fingers and your thumb, just being able to get them a little bit more activated, getting that blood flow going, getting the strength so that it's there for when you need it. And then I would love, Jenny, if you would speak about Power Up and Power Recovery.
Yeah, I'm going to be brief because I know we're running out of time a little bit. So Parkinson's Wellness Recovery, also known as POWER, PWR, it's also known as Power Up frequently because the whole idea is that you use these motions where you're powering up. It was developed by the same individual who created LSVT Big. And so it has very similar components. I think LSVT Big is I'm not sure what everyone's knowledge is of that, but it's a very protocol-based program. You're required to go so many days a week and do so many exercises on your own. And it's very systematic in a good way, but it's a pretty big commitment for some people to actually participate in that program. It's just not appropriate for everyone because maybe you work or maybe you can't get therapy 4 days a week or whatever it might be. So Power Up is nice in the sense of it's very similar in the intensity of movement and the types of movements. They're a little bit different, but you can do them in different positions just like LSVT Big. There's some sitting, some standing. You can modify a little bit, and then Power Up is a little more functional, so it's kind of practicing a movement and moving a certain way and then sort of making that into a functional movement. So maybe that means reaching for something out of your cupboard. So you're going to practice sort of these big kind of movements and then really actually reach for something out of the cupboard, which is a little different from LSVT big. So I like it in the sense of it's very similar, but it's a little more functional. So from an occupational therapy perspective, I like that, especially if you maybe can't commit to the 4 days a week and kind of that intensity in the protocol of LSVT big. So it's a great option. I'm not sure how many people are certified in it, but it is very similar. So even therapists who maybe are certified in LSVT big could kind of, sometimes I just pick and choose some of the principles and the exercises from LSVT big to do with people, and I just don't call it that program because I'm not doing that actual program. So I know Kristen has one at the end, but there is a directory through LSVT Global where you can search for therapists in your area that are certified. So again, that would be that LSVT big protocol. But again, you could maybe call and say, you know, I can't commit to that program, but I still want a therapist that I know is well versed in this. And I think that's really great. So yeah, Power Up is very similar. And this little video she has, I like, is showing how to get up from a chair, kind of using some of the techniques. I don't know if we'll show it, but you can YouTube, like she was saying, YouTube is a great resource. You can find all sorts of things on there. So you can even do like LSVT big and you'll find all sorts of things.
Great, thank you. Yes, we get better at what we practice. So definitely just practicing getting up off the floor helps you feel more confident and helps your fall prevention. And definitely both of these systems are research-based, designed specifically for people with Parkinson's. And I know I wish we had time to watch this video, but I'm going to move on just so we can get questions as well. So thank you, Jenny, for talking about building your care team. Definitely you could get referrals from a doctor, a neurologist, movement specialist, the home health. And she did speak a little bit about Thrive Therapy as well. That would be a great resource to have for you guys. There's the Parkinson Foundation helpline. And as we've mentioned, a recommendation is to spread out occupational therapy appointments once a month or bi-monthly or often as the disease progresses. So I'm going to quickly move through here real quick. Support groups are great. We've talked about videos and podcasts and things for care partners. So let's get to your questions. I don't know if there's any questions in the chat or if you guys want to turn on your cameras and ask any questions, feel free.
I don't see any in the chat as of now, but also we included our emails in the PAR exercise class email as well. So if you do have questions or maybe as you kind of think about this, or maybe you watch it again on YouTube or something, yeah, you can feel free to reach out to us through email as well.
It looks like we have one question, Lushana, but I can't unmute her. She's self-muted right now. So if she unmutes, or if they unmute themselves, then I can unmute them and they can ask their question.
Okay, not sure. But yes, feel free to email us if you need to. Oh, hi.
Hi, I have a friend that's watching the webinar with me, and his brother was just diagnosed with Parkinson's, and he loves to ride his bike. Can OT help with that? And what might that look like?
Yes, definitely keep riding. We just encourage people to stay as active as possible. Jenny, would you like to add anything else about what you do with this person?
Yeah, I think it's hard to say, right? Like without really knowing a lot about him, if he's riding and he still feels comfortable and he's able and not falling and thinks, great, keep going. If he's maybe having trouble or there's some concerns there, maybe it's safety or balance or whatnot, then I would probably look at modifying that. So maybe that looks like you riding a trike instead, or a tandem bike with somebody else. Maybe it's an indoor exercise bike, something where he can still do that task, maybe in a different way if there's an issue. But if he's doing okay, I would say, yeah, keep going. I would caution a little, like I would make sure, he's wearing bright clothing, reflective clothing, some of that, has his phone with him if something were to happen, some of those safety things. But yeah, again, kind of hard to say, but does that answer your question?
Yes, thank you very much.
Any other questions?
I have a guy actually that I saw recently, and he was still riding a bike. He's doing okay. He was using a walker to walk, but he could still ride a bike, but he was riding like those trikes where you like sit kind of low to the ground, 2 wheels in the back, 1 wheel in front. So, I mean, if you can, I think, yeah, keep going.
All right.
But great suggestion. Oh, I'm sorry.
Sorry. We have another question from Holly, but she is self-muted. So if she unmutes herself, she should be able to talk.
It's not a question. I was just saying it was very informational. Thank you.
Thank you. Great. I'm just going to go through the references, and I put this up here. There are so many podcasts that really helped me learn more about Parkinson's. The Parkinson's Association of the Rockies, like I said, has a ton of webinars and exercise videos. They're listed at the bottom. But this just gives some things for people to learn more. And then very quickly, if you guys would take this short survey that just helps me in my doctoral capstone project. You can scan this with your phone. It should be able to pop up a survey for you to be able to do. And I want to thank so much Jenny for doing this presentation with me. And again, thank you to the Parkinson's Association for the Rockies. Was there any last minute things that either Melissa?
We just want to, the Parkinson's Association of the Rockies just wants to say thank you, Jenny and Kristen, for doing this wonderful webinar for everybody. And this will be up on our YouTube page in hopefully a few days. Does anybody else have any questions or concerns?
Great.
Thank you all very, very much.
Thank you.